So I'm Lee Pavak, and I'm coordinator of our class today. And I'm delighted to have Dr. Brian Davis speaking with us about how Holland is bridging educational inequities caused by COVID-19. And the idea of a course on this started a year ago, actually, as we were starting to cope with a society that was completely shutting down. All schools throughout the country shut down, and many schools are still struggling to get back into the classroom safely and effectively. Happily, early on, Holland Public Schools took the lead in this and partnered with local community organizations to identify the problems caused by the shock to this educational system, which were not just about education itself, but also things like food security and safety and many other issues. And so we kind of mounted a community response. And as part of this, the shock to the system has disproportionately fallen on Black and Hispanic communities. And that was something of interest from our organizations interested in diversity and inclusion issues as well. So this is a perfect opportunity to reach out to Dr. Brian Davis, our superintendent of Holland Public Schools, and talk to him about the process of jumping on this huge transition caused by pandemic and calamity, but really evolved into a solution that continues to evolve today to meet the needs of this community and its education and living. So with that, I'm going to introduce our speaker, Dr. Brian Davis. He's superintendent of Holland Public Schools, and he was recognized as Michigan State Superintendent of the Year by the Michigan Association of School Administrators in 2011. He's been shaping education policy and school reform efforts at the state and national levels. So, very highly regarded and has been exposed to lots of different programs. He earned a BS in education from Central Michigan University and an MA from Eastern Michigan University in K through 12 school counseling. His PhD is from Western Michigan University, and that's in philosophy and educational leadership, research, and technology. And being comfortable in technology was certainly a skill that helped him cope with this pandemic. So with that, I'd like to hand it over to Dr. Davis, and he will take over the screen and launch his presentation.
Well, thank you so much, Lee. My pleasure to be here, and it's great to look across and see some familiar faces and some familiar names. Just a little bit more background of who I am as we launch into this work. I was born and raised on a small farm in rural Hillsdale County, 40-acre farm. Grew up understanding the value and ethics of hard work, the appreciation of the intersectionality of nature and family and school. And there were only 48 in my high school class. So it was a very small school district. There are approximately 500 students in the district today, all in a single building on a single campus, K-12. So it's quite different in terms of the education and opportunities that kids have there in comparison to what we're able to provide here in Ottawa County. I'm also a first-generation college student, the first Davis to go on to college in any capacity, the first one in my family on both sides, my mom and dad's, to earn his doctorate degree. So I have really grown to appreciate the value and importance of education and the opportunities that it brings forward. I was a free reduced lunch kid. Having to deal with the stigma when I was in school of walking up to the lunch lady and paying my 35 cents versus paying the dollar that everybody else got. And so the embarrassment and humiliation of getting that change handed back to me. So really having a compassionate heart and a desire to be able to work with students and families who not necessarily always have the same privilege that is afforded to others. At that same time, though, I recognize that as a white male, raised in a two-parent household, as a person who speaks English, as a person who has navigated the system, as a person who sits in a chair that is responsible for making a lot of decisions that help shape our community, I understand that the privilege that I hold and carry with that, and not everybody has that. And so I just want to acknowledge that today about a little bit of background of who I am and the privilege that I carry. And I'd also like to recognize all of the young ladies who are joining us today in this HASP class as we celebrate Women's History Month and all the contributions that each and every one of you have made to our community. Thank you so much for doing that. Whether you are a stay-at-home mom who helped your child learn how to read and write and navigate through the school system, to those of you that had careers, to those of you that supported nonprofit organizations, whatever it is that you did or continue to do, thank you so much. So COVID-19, what a impactful time it's been. I was doing some quick math, and I can't have an exact number, but this might be my 3,572nd Zoom meeting since March 16th of last year. That's all that I seem to do. Whereas before, you would oftentimes have 4 to 5 meetings a day, and you're often driving across town to get to them. Now it seems as though we have 10 plus meetings a day that are always back to back. So the whole notion of being able to sit in front of a computer screen, I've developed COVID-19 just around my waistline and not necessarily in my respiratory system. I'm sure some of you have had the same experience. But what happened? We woke up on March 13th hearing that there was a new pandemic that was likely going to impact not only our country, the state of Michigan, but the community of Holland. And Governor Gretchen Whitmer, alongside of members of the health department and senior staff from the Michigan Department of Education, announced that schools across the state, all K-12 public, charter, parochial schools, private schools, were going to be closed. And that was quite an alarming situation for a school leader, for parents, for students, for our teachers, administrators, because this was something that none of us had ever experienced before in our lives. To be able to talk about the inability for us to do school based upon a relatively unknown virus at the time, of course, all that we know today to be COVID-19. And some of those same fears and trepidation are still circulating as we talk now about the number of variants that are now impacting not only the country, but Michigan, as new variants from the South African virus are now present in our state as well. This announcement was met with not only a lot of fear and trepidation, but also a lot of angst. It was during a very politicized time in our country. It was during a time when individuals felt as though their freedoms were being taken away. And it was difficult to find individuals to be able to have shared common understanding around values and beliefs. People believe in overall health and safety, but did they value doing it enough to be able to make decisions and care for others in such a way that would protect everyone from a sense of a common good? And there were so many policies and practices, and still being debated today. We'll talk later about the supplemental budget and the $1 billion that's being held in Lansing today, as our legislators have written into the code for the budget that the governor may veto and not sign, sending millions and hundreds of millions of dollars back to the table for discussion, stripping away the authority of the Michigan Department of Health and Human Services to ever close our schools again in the future. That's a pretty significant legislative piece of action to take place, balancing the health and safety of individuals against the educational opportunities of our students. And how do we bring those two pieces together? That was the big conversation that we began having on March 13. How do we possibly do this? I firmly believe and understand and know that the best way for a child to reach his or her potential, academically, socially, emotionally, physically, is through the interaction with other peers in a school setting taught by highly effective educators. And that was taken away. And there are still many school districts today who aren't in school across our state and across our country and have no plans to return to school yet this year. We began to talk about, all right, regardless of this pandemic or not, we're coming back to school. And we shouldn't waste this good crisis that presents before us. How do we come back to school when we are able? And really keep in mind that business should be not coming back and returning as normal, but it should be business as unusual. And so I put together a task force in March, a couple of weeks after the governor's announcement, that included over 100 internal and external stakeholders across the community, teachers, administrators, wanted to make sure that we had student voice, the leadership of our collective bargaining groups, parents, community partners that walked alongside us prior to the pandemic to talk about what is it that we can do to bring individuals back. And then the Return to Learn plan came out about 2.5 months later under executive order, and we had to review over 400 different school-related factors and make decisions about in order for us to return kids back safely to school and to make sure that we were providing an environment that was not only safe but also healthy for our staff. This business as unusual plan was aligned with our strategic plan to ensure that we could embrace, engage, and empower each child for success in an ever-changing world. And little did we know as a Board of Education what an ever-changing world it was going to be. We're coming up on the anniversary of this March 16th next week, when we've been in this case now for 365 days. We had 5 different committees that represented these different stakeholders looking at parent and family engagement, being able to address what was the rest of the school year going to look like, what was summer learning going to look like. Certainly we were going to be facing a lot of unfinished learning. We also knew that we were going to have to begin talking about different hybrid models of instructional practice. What was going to be done synchronously, live, like what we're doing right now, or what would be done asynchronously, where teachers might record lessons that students would be able to watch at home at different times with their families. We found a number of students not being able to attend during the day because they had to become now workers to be able to make up for the lost income that many families in our Holland community were facing. We had more and more high school students working in part-time jobs than we've ever had before, creating additional stressors and additional social needs for our high school students. Building management was going to be a significant component with respect to our Return to Learn plan. Being able to address hundreds of different mitigation factors that would look at everything from air quality control units to cleaning protocols and procedures to wearing masks, all those kinds of things. And we didn't know what our budget was going to look like. We had to be able to have some very specific conversations around our budget because we knew there were going to be a lot of additional costs associated with this. So I developed some driving questions with respect to each one of those. And I recognize this might be kind of small, depending on how far one is leaning into their screen here. But around parent and family engagement, to be able to talk about what are the new roles and expectations of parents to take on and support their children's learning at home. Parent now became a teacher. Again, we talk about parents are their child's first teacher during those prenatal years, months, and all the way up through 0 to 5 before kids actually enter school. New roles and expectations. I have parents who haven't graduated from high school. I have parents that contacted us and say, and communicated, I don't understand how to teach this 5th grade math or this 8th grade math. We don't have reliable internet access at home. We're living in a 1-bedroom apartment right now. I have 4 kids trying to do their homework, 2 of us trying to work from home, and we have 1 device. And at the same time, I had families who hired retired teachers to live with them through the course from March to June to provide education to their students because they simply said, I can't do this job. We had parents of special needs children with autism, emotional impairments, severe multiple impairments, visually impaired, deaf or hard of hearing, who were challenged with being able to provide the necessary supports at their home for kids to learn. So the role of mom and dad, grandma and grandpa, aunt and uncle, whomever that caregiver was at home, changed drastically. So we had to talk about how do we best support parents in this transition and how do we help them sustain these new roles and expectations. At the same time, they're trying to maintain their work, trying to figure out what does that look like to work remotely from home in many cases and manage that. And we had to really establish some new communication protocols. How do we engage with families in a 2-way process that allows them to understand and know what's happening and going on? We needed to talk about driving questions around this missed learning or unfinished learning. And even today, we're having conversations around that. Who are our most vulnerable students and what are they going to need? What partnerships need to be enhanced, developed, put on pause, brought back in? We are just now going to be asking our Kids Hope mentors, which we've had a partnership for nearly 25 years, to just start to come back into our schools after spring break, hoping that many of them have had the opportunity now to become vaccinated. What supports are going to be needed to transition our students back to school? When students had been out since March, coming back in the fall, excuse me, there was a lot of teaching and reteaching that we were going to need to do. What kinds of learning losses were going to happen? And we found an incredible need when we had to transition students back in January who had decided to take advantage of online learning opportunities that first semester. And we found students who came back to school then to a very foreign place. School looked completely different than when they had left, and all their peers had somehow moved forward. The inability to see their teacher's mouth, the inability to see facial expressions and those social cues, the inability to be able to play with your friends in different classrooms on the playground. All those pieces impacted the school learning community and are still in place today. And I'll dive a little bit deeper into a few of those in a few moments. We had to talk about what does blended and hybrid and online learning and all these pieces look like, and how do we support teachers in making this transition into that environment. A lot of people think, oh, well, remote learning, online learning, you just flip the light switch and away you go. Well, it's not quite as simple as that. And certainly you had to be able to recognize that there were many, 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 many families in our community today who still do not have reliable broadband service that can meet the demands now of many of these learning platforms. We also had to develop a learning management system where all of this curriculum, instructional videos, assessments, work, support systems, books, all of the students' assignments would be housed in one place so that a parent didn't have to go to 3 different websites for 3 different teachers and 6 different teachers at the high school if you had a high school student, everything being housed in one location. We had to figure out how we were going to manage social distancing with 4-year-olds and 18-year-olds. And the conversation was there was no way you're going to be able to do this. There's no way that these students are going to be able to comply and wear masks all day long for 8 hours a day. And we said, well, rather than talking about what students and staff can't do, how about if we focus on what we can do? So really trying to shift that conversation as well. What kinds of different schedules would need to be developed? Did we want students traversing through the high school, passing classes 6 times a day, increasing that amount of contact time? We knew very little at the time about the spread of the virus and what it would be, but we knew what the expectations are. Parents wanted to be assured that they were going to be able to send their kids to school in spaces and places that were going to be safe. And we had to do this without a budget. We had no idea what our budget was going to be to make all that happen. So a lot of this planning and work that was being executed by this team, there were a lot of unknown factors about how we were going to pay for it, but thankfully we're moving through. So as we're doing all this work, Governor Gretchen Whitmer released their My Safe Schools 2020-21 Return to School Roadmap. And there were these 6 different categories that schools were going to be identified in based upon the positivity rates and rates of infection across our community. Everything from uncontrolled growth to post-pandemic. And I think we're probably now somewhere in phase 4 to phase 5. We're improving and we're containing the spread with the number of individuals that are being vaccinated, but we're certainly not in that post-pandemic phase yet. Each week, it seemed like we were getting new expectations and new rules as people were beginning to better understand the impact of the virus. So as a school community, we had to learn how to be very nimble, very creative, and be able to say, what I'm communicating to you right now could have changed the minute that we started this meeting, because more and more information is being learned and updated. And that happens to us still today. So there was a lot of guidance being provided us to do that. So what did we have to do? We had to look at a number of factors. We knew that one of the requirements to be in school is that all of our high school students needed to wear masks. Middle school students, that was then added, and eventually elementary students. we started the school year with all students that were going to be in person required to wear a mask. And I have never seen something become so politically charged in my life than a piece of fabric that looks like this, that's placed over one's mouth and nose. Communities today, school districts today still aren't in school. Board members have lost their seats. New board members have come on in different communities. Some of my colleagues across the state have lost their jobs. Teachers refusing to work, employees wanting to work over the idea of wearing a mask. I can share with you, we haven't had a single issue with wearing masks in schools, all the way down to our youngest kids. It was a requirement to attend school, and if that was something that as a family you chose to not be able to do at that point in time, we did provide those online options. But we had to intentionally teach all of these skills and what that meant. We had to talk about what it meant for young kids and even older kids to maintain social distancing practices, being 6 feet apart in schools. We had to talk about all of the cleaning protocols of washing the hands and cleaning the desk. Unfortunately, not being able to have any visitors in our schools. We had to create cohorts of individuals, and that's what that pie chart there with the kids kind of singled out is set to be. Today, an elementary classroom spends his or her time together all day long with their teacher. They eat breakfast together in their classroom. They eat lunch together in their classroom. They play together as a class in designated areas on the playground with their own separate playground equipment. Their special classes like art and music come into the classroom so that we can cohort students together to reduce that spread. Or if we have a positive case that impacts our school system or a classroom or a building, we're able to quarantine or isolate fewer students than necessarily having to shut the entire school down. So cohorting became a very important part of our plan. That, as you can imagine, created further social isolation from individuals and from families, from students at school, even from our teachers. Teachers were no longer able to come together in the teacher's lounge to be able to congregate together in such a way for fear of that spread of the virus. We created then block schedules in our 6th through 12th grade program. And basically what that means is rather than having 6 classes a day where kids traveled and passed their classes for their math, science, English, social studies, etc. all day long, 6 different teachers, 6 different groups of students, we created a block schedule where they only had 3 classes on Monday and Tuesday. Those classes were double in length. And then on Wednesday at the high school, we have what's called a blended day where students don't have to come to school unless they require additional academic assistance. And then on Thursday and Friday, you had your other 3 classes. That way, if we had a student who tested positive to COVID-19, we only had to work on addressing those 3 classrooms that that student was in versus 6 classrooms. And so we're able to reduce the number of students who had to miss school. Because you see, if a student was impacted within 6 feet for 15 cumulative minutes, still the case today, to a positive case, you then had to be quarantined at home for 14 days. We have students that have been quarantined 4 times. Well, if you take 14 times 4 and do the simple math, you've just realized now they've missed a significant amount of school time, almost 3 months. And so the ability to be able to provide that environment to reduce the amount of spread within our schools was key to what we did. Being able to not eat together as a high school community was a very different thing. Being not able to have an open campus where students could leave. But the flip side to all of that is the incredible relationships that have developed between our teachers and their students. They certainly have become families. And during these extended times together, teachers have the latitude and flexibility to take sensory breaks, as we call it, when they need. Because we know, I don't know if any of you have tried to wear a mask for 6 hours plus, it's a challenging piece to do. So teachers and students are allowed to take sensory breaks, to take their classes outside whenever they feel as though it's necessary and critical to do so, and students are able to remove their mask during that time. So we had all those health logistics that we had to figure out, and all those different schedule pieces. And then we had to figure out, okay, we have to provide different learning modalities for our kids too. We wanted to be able to do in-person instruction, as that bottom screen shows, and to be able to do that in such a way where students had their individualized space to provide as much distance between as we can, to make sure that every student every few minutes is washing their hands, washing their desk down, not sharing materials back and forth. Can you imagine, for those of you that were teachers prior, what your classroom management strategies and skills needed to look like today? And to be able to provide in learning that was going to continue to be exciting and engaging. To what does it look like for a teacher in the center screen there to teach remotely via a Zoom piece synchronously with the class? Because now I might have kids who were in person with me, but now all of a sudden they've been quarantined, and I got to figure out a way how I can teach to them at the same time and allow them to stay current. I was in a 5th grade classroom last week where the one 5th grade teacher was out. There was a substitute teacher. Her teaching partner in the room next door was teaching via Zoom in her classroom to both classrooms. So the students were able to see her teaching in the classroom next door as kids were on their screens in their own individual classroom, being able to learn and do. Interestingly enough, we thought that those who would select the online learning, who might likely not want to send their kids to school, might be families from a different class and race than many individuals, I'm assuming, that are on this class today. Many like me, middle to upper middle class, white. But I can share with you that 90% of our online learners qualify for free or reduced lunch, and the vast majority are Hispanic or Black. Now, individuals might ask themselves the question, Brian, why is that? Well, the simple answer rests in the data. COVID-19 has significantly disproportionately impacted our Black and Hispanic communities across the country and across the state. When I was first engaged in this work, I was able to say I didn't know a single family member or friend who had tested positive for COVID-19, nor had I lost a family member to it. I can't say that today. I know many people that have tested positive, and I've lost a family member to COVID-19. However, in talking with one of my colleagues on the east side of the state, who had lost 26 close friends or family members to COVID-19 as part of the Black community, we have to step back and ask ourselves, why is that? Another time, another day, perhaps another class, but it may rest deeply with some of the institutions that still exist in our country that are institutionally segregated, or perhaps have inherent racial disadvantages related to the healthcare system and access to things that some of us have the pleasure and have always had in our life. So that disproportionate impact of the healthcare system and the disproportionate number of families of color that were being impacted by the COVID-19 virus and dying, and even today, the access to the vaccines is vastly different. And so that contributed to the safety and security of families of our communities of color wanting to send their children to school. The impact of safety and security. So up in the top right screen, and now as I say this out loud, I probably should have tried to search for a different photo. But the number of families who are now at home online, living in poverty, multiple at-risk factors, maybe not even speaking English as their primary language at home, perhaps having students with multiple disabilities, were now charged with how do I provide education. Now I can tell you our teachers were working their tails off. They were doing everything possible to provide robust learning experiences. They were contacting their parents a couple of times a day. They established open office hours where parents could call in and get additional help, where students could call in and get additional help. And you know what we began to hear? Whoa, too much communication, too much support, too many things to read, too many things to understand. We're just simply trying to survive. We're trying to figure out, what does this mean to be at home? We're trying to figure out, what is this new thing of not being able to go to church or to the grocery store or to all those social events and activities when things are shut down in quarantine. We're just trying to figure this all out. We're kind of come full circle on that, because now, in order to receive some of the funding that is being made available by the state of Michigan, all well intended, mind you, summer school has to be 8 weeks long this summer and 5 days a week. And you know what I'm hearing from most families? My kid just needs a break. They just need to play outside. They just need to be with their friends. You know what I'm hearing from teachers? The same thing. I need a break. Do you even understand how challenging this year has been? So we are in this juxtaposition, this dissonance, this place of, how do we recapture what generation, I should say, of children have lost? How important is it what they lost to make up? Can we ever make it up? What does that look like? And I would argue to say, whether it's 3 weeks or 8 weeks this summer, that's not going to make up for the year plus that's been lost. And the more we try to push the academic piece, the more we're going to negatively impact the social and emotional piece, not only of our students and our families, but of our educators as well. So we have to be mindful of that. Currently in the state of Michigan, this was as of last month, this shows the number of districts that are actually providing different levels of instruction. Each month, the Board of Education has to affirm their plan. So there's only 26 districts that are fully providing in-person instruction, and that's it. There's no online options, there's nothing. There's no hybrid models. There's 26 of those. There are 125 districts in the state that are fully remote and online. 125 districts where kids have not been in person since last March. I saw a couple of you that I can see on my screen kind of shaking your head. I kind of shake my head at that too, because we celebrated about 4 weeks ago our 100th day of school. We celebrate and are prideful of the fact that Holland Public has been in school every day that we've been allowed to be in school. And that's true, I want to add, for all the school districts here in Ottawa County, the public schools, the private schools, and the charter schools. Ottawa County, we've been working together to make sure that our kids are in school. We meet twice a week as school leaders and have been since March to share our best practices, to make sure that we're working together, that we're providing consistent options for our families so that individuals don't feel as though one district is safer than another, that one district is providing more than another. And at each of those bi-weekly meetings that we're having 2 times a week, we have members of the health department staff there with us as well, walking alongside us to make sure that we're providing those great options for kids. And then you can see there are about 500 districts that are fully in person, but also providing some kind of hybrid or online option. There are some of our largest school districts in the country haven't returned back to school yet. Kalamazoo Public in Michigan isn't going to return to school this year. So if you can imagine, the kids now will have been out of school for 1.5 years. Different community variables perhaps, but at some point in time we have to say, what is it that we can do to get kids back in school? And if Ottawa County can do it, and if Holland Public can do it, I believe that every community should be able to come together to make that happen. And it was because I believe those stakeholders that came together with a focus on our kids, with providing options, that helped to do that, so we could help reduce that equity gap that came into place. So imagine being a teacher. You're now at home. Depending upon where you live, you're now expected to operate a learning management system. You're now expected to conduct your classes via Zoom. You're now expected to create all these instructional videos, and you log on in the morning and you have no internet connectivity. Or you're in the middle of a fantastic lesson and then all of a sudden your internet goes out. I happen to live out a little bit closer to the lake on the north side of Holland, and depending upon how hard the wind blows, I would get that little message on my screen. Perhaps some of you have seen it. Internet is unstable. What do you mean it's unstable? I'm trying to do a meeting right now. So there is a group of us that have been working now for a little over a year. Some of you may have participated in the listening tour. We're looking at how we make broadband ubiquitous across the city of Holland. How might broadband become the fourth utility managed by the Holland BPW? How do we ensure that every single address in the city is connected to a broadband service where we will not have those interruptions and those internet challenges? You may have seen in the Holland Sentinel recently that we were awarded 500 hotspots. If you didn't know what a hotspot is, that's what that little black square device down in the left-hand corner is. But those hotspots run out of data. They only operate at 3 megabytes. Most of you probably have machines that are running at 50 plus right now. There's data capacity issues, and you can't necessarily run multiple devices on a single hotspot in your home. But it's a solution that we're trying to bridge and close that digital divide. We had to make sure that we had hotspots in homes that didn't have reliable internet connection. And in addition to that, we were sending home devices with every student to be able to do that. You may have seen pictures in the Holland Sentinel where we had the drive-up lines where kids would drive up with their parents' cars. Our staff would have their gloves on and their mask and their shields, and delivering the technology devices and those instructional packets to be able to be sent home for our kids to be able to do. So being able to provide that reliable internet connectivity, so we didn't further separate out those that have privilege and access in our community versus those that don't. So that a zip code or an address did not create additional barriers for students to have access to learning. My goodness, it's 2020. I didn't think we were back in 1960s with Plessy versus Ferguson talking about separate but equal. And unfortunately, we still have separate but equal pieces where many elements of the institution of education still have a lot of racial undertones. COVID-19 exposed so many of these. Internet is just one. And internet became the topic that was discussed across the state. And I said, whoa, I appreciate that, but let's talk about food insecurity. Let's talk about the food deserts that we have across our communities. Let's talk about the individuals who lost their jobs, who lost housing. Let's talk about the impact that COVID-19 had on our communities of color. Those are much more difficult conversations to have. It's safe to have conversation around broadband. And guess what? There were people of privilege who were having those challenges as well. So of course I want broadband. So of course I'll get engaged in that conversation too. It's much harder to engage a community around some of those other topics. Patrick Sisler was scheduled to be with us today to talk about the impact on the community from a variety of different levels. And I participated in the COVID-19 Human Response Team meetings. They were meeting weekly, then bi-weekly, and then twice a month, bi-monthly, and bringing together about 70 different nonprofits in the areas to be able to talk about those wraparound services that are needed for our families. Now, between March and June, all of our kids were online. We weren't able to come back to school. 70% of my kids qualify for free reduced lunch. One of the biggest decisions I have to make, or the most challenging decisions, the one I hate the most, is having to call a snow day. Because I know if I call a snow day, there's going to be a percentage of my kids who aren't going to have access to heat potentially at home, and they may not have access to food, especially if that's a Friday. And so we had the task of being able to say, how are we going to feed our children across the community? We developed 19 food distribution centers between March and June, staffed by volunteer teachers and volunteer community members, and we served nearly 300,000 meals between March and June. It was open to any child in the community, whether they were a Holland Public or a Holland Christian or a Vanderbilt or a Black River. We didn't care. We wanted to make sure as a school district our kids were fed. Those food distribution centers continued through the summer. They're still in place today for our online learners to make sure that no child has to go without having the proper nutrition and pieces. Many of us might be hearing about the new federal stimulus that's come into play, the additional amounts of money that are going to be provided for those that are still unemployed, the number of individuals that remain unemployed because entities are just now beginning to come back to work. And many of my families worked in those service industries that have been greatly impacted by COVID-19. A professional job like myself wasn't impacted. All public school employees were paid March through June regardless. If you didn't pay your employees or lay them off, you didn't receive your state or federal aid. So that was a privilege I had just by the sector in which I worked. Many of you may know individuals who worked in different sectors who weren't impacted by COVID-19. But if you look at wealth distribution, if you look at some of those job pieces, our communities of color, again, were once more negatively impacted than others. So I want to share with you where we kind of stand and to point out some of those discrepancies. And I'm going to just quickly move to a different screen here. And we're going to go out to the Ottawa County Department of Public Health website. This is a public domain that you are able to go to. And I just closed out all the screens that I wanted to do. I have way too many things open up on my desktop here, so bear with me just one moment. I'll go back and do it the old-fashioned way. So this is the Ottawa County dashboard. And if you go to that site, you can chart and take a look at where we are as a county since the pandemic began. You'll see that we've had just over 22,600 positive cases in our county, 346 deaths. You can see the rate of hospitalization and the number of individuals that have recovered from COVID-19. You're able to then see how the different ebbs and flows of that, where we were able to bend the curve. When we've had some spikes in that, you can zoom in and actually look at the number of cases. You're able to also then search it by zip code in Ottawa County to be able to see that the zip code of 49424 has been impacted greater than other zip codes across the area. 49423 is that next one down, 49426, then you can hover over those and see where they're at. 49423, which is the city of Holland, which is where primarily most of my students reside. You can see the total number of cases there. So what's the impact across our community by county? You're able then to break it down by age group. And this was important to me and our schools to continue to monitor with the health department. As you can see, the 0 to 9 here at the bottom, there have been 824 children who have tested positive for COVID-19 since this began. 3,051 for that age of 10 to 19. I wish they had done 10 to 18 because with 19-year-olds, you start to get into that college component. And if you recall and you think back the impact that Grand Valley State University had and Hope College had and a lot of universities, not only in Michigan, but across the state, we saw an explosion of cases there relative to social distancing. You're also able to see with the white dots, the total number of deaths that are within those age brackets. Unfortunately, the greatest number in the 80-year plus. And so when we were talking about the number of cases in the schools, when we were talking about the number of deaths, we firmly really believed that school was the safest place for kids. It wasn't home unstructured and unsupervised, not necessarily following all the social distancing protocols at home or in their neighborhoods. We firmly believed as a county, as school leaders, that school was the safest place for all kids to be. And that has actually proven out to be the case. You can look at what's the impact of gender. Who seems to be contracting, at least in Ottawa County, COVID-19 in comparison, so that you see that females, for example, represent 50% of the county, and they represent 53% of the total cases with respect to COVID-19. Conversely, males represent 49% of the county and represent 46% of the cases. So not a significant difference between the two. But if you look at deaths, men are more likely to die from COVID-19 than are females. So while females represent more of our county, they represent less of our deaths, Men represent less of the county, but more of the deaths. 54% of those deaths associated in our county are men. So just an interesting piece from there. It'll be an interesting study to take a look at some point in time. The data also breaks it down by ethnicity. On this screen, you'll see what the Ottawa County population is, their total cases, as well as their total deaths. So you can see that while the white population makes up a little over 80% of the population in the county, got to slide it over there. I'm sorry, just under 90% of the county, they only represent 77% of the cases. You can see Asian is pretty in alignment, as well as Black or African American. I can tell you that Black or African American, when this first started out, was out of sync with their demographics across the community. If we break it out and look at who's Hispanic or Latino, or who is not Hispanic or Latino, we see some slight differences there. Approximately 10% of Ottawa County is Hispanic or Latino, much higher here in the city of Holland, obviously. I wish we had some more specific demographic data to show for that, but they represent 13% of the total cases, whereas 90% of the county is not Hispanic or Latino, and they only represent 74% of the cases. So you begin to see some differences across the communities that way. So just some interesting data, if you want to dive a little bit further into that, to be able to understand what the impact is in our community. I want to share with you some additional information that we have that takes a look at some different demographics here in Holland, and what we're monitoring very specifically with our health department each week as well. So we get to meet with the senior epidemiologists from the Ottawa County Department of Public Health. And we also get information shared with us on a regular basis from the State Department of Public Health, as well as the senior epidemiologists from University of Michigan. So it really seeks to provide us the most accurate information. So growing up as a kid, I always wanted to be a doctor, a medical doctor, a pediatrician. Obviously, I never made it there, but it feels as though we've been asked to be doctors in many respects during COVID-19. So this is some case trends. This is as recent as our meeting last week on March 3rd, to be able to look at what's happening across our community as well. It just breaks it down. And what's great is we're starting to see the cases decreasing. Especially if you look back where we were at in September, you can kind of see these different times in which we had additional outbreaks and curves. And oh my gosh, just that explosion over November and December timeframes, bending that down a little bit and then back up in January. There seems to be those 2-week hiatuses after holidays or times when people come together and gather, that you have these other super spreader events. But we're currently averaging about 28 cases per day of COVID. The school-affiliated cases, which is what we are really mindful of and taking a look at, we're beginning to see that we're down to about 5 to 10 cases reported each day over the last 4 weeks. So we really feel within the school community, we have rounded that curve and being able to keep our kids in school more so than what we were before. Kids not losing as much time as what they had. Holland has had 2 outbreaks that we've had to report, and an outbreak is considered any time when you have 2 or more related cases. So if you have one of our cases was with respect to 2 different families who had a parent or grandparent contract COVID. Their child then contracted COVID, and they rode together in their car to come to school. That was considered a related case because we didn't know exactly where that came from. So when you hear the word outbreak or heard the word outbreaks before, sometimes when you think of an outbreak, it might be 2,000 plus students. In this case, it could only be as few as 2. So the cases are declining. We are seeing that after we've made it past the holiday breaks, we seem to see a significant decline. But of course, we're all now beginning to worry what's going to happen after spring break. And as you watch on the news, people are already traveling. A lot of states have opened up and lessened their requirements. And so now there's a great concern that we could find ourselves back into one of these components where we have a significant increase again. certainly the issue of racing to get people vaccinated is going to be an important thing. Where the positivity rate is declining amongst our school-age population and overall down to that 2.9%, so being below that 3% threshold, where a lot of individuals are taking a look at being able to do. So there's some good news that's coming with respect to COVID and the impact within our overall community. So if you can think about what my role has been as an administrator, as school leaders, it's a lot of talking about with respect to what's happening in the trends, what's happening to be able to continue on with our cases and keep kids in school. I've spent more time on medical things than I've actually been able to spend on items related to learning. So we had to communicate with our parents, and we had to create hotlines for our parents. They could call in a hotline to talk with our nurses. They could call in a hotline to talk with our technology experts to help troubleshoot at home. They could call in and be able to understand what are the different learning modalities that we have. So we have an entire Return to Learn website that's dedicated to all the things related to COVID, all of our different plans, all the ways to stay safe, all the different toolkits. All of this information is able to be translated in multiple languages, but I wanted to share with you what the impact has been on Holland Public. Currently, we have 5 students who are out with COVID-19. We have 0 staff that are out. We've had 120 students impacted by a positive case that we're aware of, and thankfully our parents have done a phenomenal job self-reporting those pieces to the school so that we can keep everyone safe. We have 43 staff that have been tested positive for COVID. That's about 10% of our total employee group. This includes all employees across the district. We've had 5 school-related cases with students, and we've had 1 school-related case among teachers. So the whole notion of COVID being spread student to student in these mass numbers, or students sharing it with teachers, or teachers sharing it with students, just hasn't occurred. The data really being able to support that schools have been the safest place for our kids. When I look at the data of some of the communities where schools aren't in session and they had positivity rates 14, 15, 18, 20+%, if I were going to get another doctorate, I might do my dissertation on the relationship between positive cases among school-age children in the community and school being open for in-person learning. We currently have 1 staff member in quarantine and 10 students. When you have 43 employees out on quarantine, wow, that really impacts significantly the ability to do school. If I have 3 bus drivers out, I can't run transportation to get kids to school. We've had that multiple times. When you have 4 or 5 of your food service personnel who are quarantined, that impacts the ability to prepare lunches every day to be able to serve in school. When you have teachers out on quarantine, that impacts the ability to deliver high quality instruction, especially when we have a substitute teacher shortage. So COVID began to impact every single entity in the school system, everything from soup to nuts. So with that, I want to share with you a little bit more about how it impacted us with respect to the need to contact trace. My principals will tell you their life changed forever. Contact tracing. Anytime you had one of those positive cases occur, you had to go back 48 hours and try to figure out who that student may have had or that adult may have had contact in for 15 cumulative minutes. 7 days a week, through every holiday, through every break, through the summer, schools have been asked to do this contact tracing, to be able to identify who are those individuals that need to stay home. Some of my principals would tell you that has consumed their time at school. Not so much now, but especially between that October and January timeframe. So to be able to be instructional leaders, they weren't able to do so. They were spending a lot of their time with their school nurses, contact tracing, making the phone calls to mom and dad to have to be able to have the conversation. I'm sorry, Miss Van Grau, but your son now has to be quarantined again for the 4th time this school year. And at some point in time, Miss Van Grau is going to say, Brian, I appreciate what you're trying to do. But my son's learning now has been so significantly disrupted. I'm wondering now if I just need to provide that education for him at home. I had to have conversations last summer with a number of kindergarten parents who wondered, should I send my 5-year-old to school this year or should I wait until next year? So we're going to see, we anticipate a significant influx of 6-year-olds coming into the school system next year as first-time kindergartners because parents decided to take and leave them home. We also know by looking at our failure rates that there are a number of students who simply have lost learning despite our best efforts because the learning online at home without someone monitoring that well hasn't been the same as what they would have otherwise received. So I think I've described for you, there have just been significant impacts across the board. Starting in the left top corner, anxiety, stress, panic, depression. We did universal mental health screens on all of our students across the district K through 12, utilizing a screener from the University of Michigan. And about 25% of our elementary and middle school students needed direct follow-up and contact with, and about 20% of our high school students. Students who identified cases of self-harm or being harmed at home. We had to make several referrals to local hospitals and emergency rooms where we identified individuals who were being severely impacted by this social isolationism. I know how it impacted me as an adult and all the resources I had. The impact that it began to have on our families was huge and continues to do so. And most of the partners that we work with, Mosaic Counseling, Midtown Counseling, Arbor Circle, Bethany Christian Services, these entities are overwhelmed with a number of families and students who need support, who just haven't been able to receive that in a timely fashion. I talked a little bit about our food distribution sites. The young man could be a teacher, he could be an administrator, he could be a student teacher. Just the additional stress and anxiety of, I came into this profession to make such a huge difference and to have that relationship with kids every single day. And I haven't had that now for a year and a half. We're seeing one of the largest exodus of teachers out of the profession than we've seen in years. The number of retirements are exploding. And unfortunately, we already had a teacher shortage on top of that. COVID-19 is just not a health pandemic. It's an education pandemic. It is a mental health pandemic. They are running parallel to each other. So an 8-week summer school, a 3-week summer school isn't going to quickly fix the challenges that we're having. The line, the red and green lines there, the up and down piece, we have some students who have done well and have excelled because they've had caregivers at home that have helped to do that, or they've had live-in tutors that have been provided by their family to do so. And we have other students where things have just declined. We already have summer slide that happens in schools, the time between June and August, where students may not be exposed to the same kind of field trips or learning experiences or having books at home to read that other families sometimes have. And we see that a lot in reading. We see it even more so in math. The research is already showing on top of the 6 months of slide that can happen during a typical summer slide for some of our at-risk families, that's likely going to be double this coming year. Despite our best efforts and all the growth that we were making, we've seen our reading scores across the board decline about 10% this year, K-8, and our math scores decline anywhere between 15 and 20%. So significant ground that we're going to have to make up. And yet today still, we're being told that we have to give the state standardized assessment to all of our kids when they come back after spring break against all the same standards and curriculum learning outcomes pre-pandemic so that we can hold schools accountable and rank them top to bottom. It's just wrong, and it's a real travesty. That time that we spend on testing should be spent on learning in the classroom. And I certainly hope that our new Secretary of Education in Washington, D.C., who has an education background, will be able to begin granting the waivers that states have come together to say, let school districts utilize their own local benchmark assessments to assess where kids are. Schools are already doing that. Teachers are already doing that. There is no reason to do these state mandated tests from an accountability standpoint. So I'm hoping that we'll hear some news about that soon. Zoom, 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 Zoom. That's what we're doing, right? Parent-teacher conferences have all been via Zoom. We can't come together. We've allowed no visitors to come into our schools. Mentoring, we've tried to do mentoring or counseling via Zoom. That hasn't worked very well. Counseling and social emotional supports over Zoom, if you're in a one-bedroom apartment, the very person that you might be receiving counseling about or try to work through some traumatic experiences might be sitting on the couch or might be in the kitchen. So it's very difficult for our kids to be able to interact and receive those kind of supports. A simple little thing. We pride ourselves that as a school district, we haven't lost a single student to Lake Macatawa or Lake Michigan. We provide instructional swim program to all of our students K-5. My 4th and 5th grade students now haven't had swimming for 2 years. We want to be able to get the kids back in the water, get in the pool. It's a simple thing, but it's an important thing. All of our grade level and department and professional staff development meetings have all been via Zoom, like what we're doing now. All of our community partners engaging with us in a virtual online platform. And some programs have just had to take a pause, and we haven't been able to do. No field trips this year for kids to be able to go out and have those experiences. You know, it's hard for many of us to believe that Lake Michigan is an unknown entity. To the west of where you're sitting, or to the east of which you're sitting, or north or south, depending on where you're sitting in your room right now. I have kids that have never been to Lake Michigan. That's a real travesty right here in our community. So everything has been put on pause until we're able to return things back to some level of normalcy. So what have we learned? The impact on families has just been significant. It's been significant to engage in that online school platform. Our mental health and wellness have been exposed to an even higher degree across all racial sectors, across all economic levels. We now have a senior class who hasn't been able to do any senior-like activities or any junior-like activities for 2 years. We've had to completely redo graduation. They haven't been able to come together socially to attend a basketball game or a football game. Quiz Bowl has to interact online. The robotics is doing things online. Our theater program had to compete online. Kids haven't been able to come together socially to connect with their peers in that way, at least in the school learning community. So there's been a lot of social isolation that's been occurring. That's going to take a long time for us to recover back from. That returning back to school has been very challenging to welcome kids into school. An elementary teacher always probably had the grade that they were teaching maybe a year below and a year above, and sometimes more than that. Now it's 2 to 3 years below where they were at. So a 4th grade teacher is really working with individuals, especially if they haven't been in school for a long time. I really worry about what that looks like, because approximately 15% of our students are still online yet this second semester. They haven't been in school since last March. They've been out for a year. It'll be August before they return again. And now we're wrestling with the fact of, are we going to have to provide online learning as an option? Because now there's a consumer-driven market for individuals to want to have that, right? And so who do you provide that to, and under what circumstances? You may have seen the news today, Grand Rapids Public Schools is going to be lessening their graduation requirements just to be able to get individuals through the system. What does it look like to give seniors this year the option of staying back a year to maybe have a normal senior year experience? What does that mean? What does that look like? Lots of conversation around retention. This is a year, until our legislators change it, I'm supposed to have to retain any 3rd grade student who's not proficient on the state assessment that we have to give in April. Do I retain 200 3rd graders this coming fall? What does that mean? I'm not going to, but that's what the law says we have to do today. Ironically, student behavior has significantly improved across the district. Now, individuals might say, Brian, you've got all these stressors going on and all this stuff. How in the world has student behavior improved? I'll tell you why. Number one, kids had been out of school for so long. School wasn't seen as a privilege in our community. And now it is seen as a privilege. I get to go to school. So the whole attitude about being able to come to school has changed. Either that or the attitude of mom and dad at home changed because they said, you've been here home way too long. You're getting yourself off to school. But the overall attitude about coming to school, I think, has changed. But more importantly, in all seriousness, we've established such specific procedures and protocols that have been consistently implemented by our staff and our administrators, intentionally taught and retaught over and over again. Kids know exactly what they need to do. Of course, we have to give reminders once in a while, but oftentimes it's the kids who are giving the reminders to each other, or sometimes even to the adults. And individuals, just the behaviors have significantly improved. And you might say, oh, well, Brian, it's because all of your naughty kids are in the online learning community. And that's not the case. We've tracked that, looked at that data too, because we wanted to say, I wonder if it's because of this. And it's not the case. So if anything, that's a great thing that's come from that. We have to continue to talk about how do we address unfinished learning that's occurred, and then being able to talk about what are the practices that we've learned this year that regardless if we have the impact of COVID-19 or not into the future, what will we continue in that whole business as unusual piece? One of the pieces that will likely continue is the block scheduling in our grades 6 through 12. We have found that students are much better able to manage 3 classrooms a day and 3 homework assignments from classes versus 6. Being able to spend that additional time with the teacher during the day to really fully, truly understand what that lesson is about. Teachers being able to really do hands-on, minds-on learning activities, to really be able to dive deeper into that science experiment. And we believe that's contributed to the behavior improvement as well, because students are more engaged in the learning. I'm not sitting in a class for 45 minutes, the bell rings, I go to the next class, 45 minutes and the bell rings. And if I get lost or behind, it's difficult for me to get caught up. So we've seen a lot of positive impacts from that standpoint. As I mentioned earlier, we have $1.96 billion that the legislature has sent now to the governor's desk for approval. This includes a budget supplemental that includes a significant amount of federal dollars. They're called ESSER dollars and GEAR dollars, directly from the federal government, from the first round of federal relief dollars. Schools haven't received this money yet, just want you to know. It's still sitting in Lansing because it's had to be appropriated by our state legislators. So we had the House that had this budget. They sent it over to the Senate, and the Senate made some changes, and now it's back to the House, and that's where the poison pill was added to the bill. It's known as a poison pill, and it's the piece whereby the governor and the Michigan Department of Health and Human Services are unable to close schools or cancel athletic events in the result of a similar pandemic moving forward. And so we're going to have to see what the governor is going to do, whether or not she's going to approve this or line item veto different things. And if she does do that, then I believe it's close to over $600 million won't be sent out to the schools. It will be sent back to the legislators for them to try to figure that out. From a community perspective, if Patrick were here with us today, he would dive a bit further into this, but really being able to take a look at engaging the nonprofit sector to really be able to problem solve around what are the real needs of members of our community in real time, everything from food to employment to housing to mental health services, from children all the way through senior adults. How to be able to get access, transportation, answers a question, all those components, and really engage the entire community in a response to do that work. And as has been the case, our community stepped up and really responded well. And we've just seen an enormous response, not just for our schools, but for all of our nonprofit sectors across the community, to be able to provide some pretty significant human service solutions to that. I just got a grant fund update from the Community Foundation of the Holland Zeeland area, and to look at the amount of funds that have been distributed just by our Community Foundation, over $1 million from the stabilization fund, 37 different recipients of that, over $600,000 in direct cash assistance to over 1,000 different individuals in our community. direct operating grants programs, everything from mental health to school support systems, $150,000 awarded to 23 different organizations. There's been over $100,000 awarded to individuals working to address racial inequities in our community during this point in time. $1.7 million in lines of credit given to organizations across the community. That's what a community does during a time like this. A community comes together and just stands up together. And so it's just been impeccable to see that happen here in Holland. And that's one of the reasons why our community is so successful. So what have we learned from that from a community perspective? We've learned perhaps a model that can be put in place for a future crisis response, something like this that might be a health-related thing. We've also learned as a community, as a whole, the disproportionate impact of crisis, especially on marginalized populations, and who needs to be around a table to engage in those conversations and who's making those connections. And we've also recognized, too, as a community, there's a lot of silver linings, that when there are people in need, when there are agencies in need, when there are organizations in need, if we can come together as a community, we can really support those. So where are we now? We're in the process of trying to do our part to vaccinate as many individuals as we can. Fortunately, during a snow day that we had about 3 weeks ago, after I got school all canceled and all those things taken care of, I got a call about 6:30 in the morning from a health department official and said, Brian, we're offering a clinic today at the Holland Civic Center. How many educators can you get over there? And I said, I can try to get as many educators over there as I can. We've since had multiple clinics, so we're working to get our education community vaccinated. But certainly, as you've been following the news, you've seen now that they've opened it up to different phases now, and being able to expand that and to be able to have these vaccines available to our larger community, hopefully being able to get 90% of that population vaccinated by this summer. I know is a national goal. I'm hoping that we can get there. We have about 35% of our employees vaccinated at this point in time, either their first and or second dose. We have several more clinics coming up, so we're still a long way to get there, but we're making progress. I remember several weeks ago, after the first vaccines were emergency approved, Ottawa County was getting 975 vaccines a week. 975 vaccines a week. If you do the math, that was going to take us about 2 or 3 years to get everyone just in Ottawa County vaccinated. Now, fortunately, those available doses have significantly increased. So what might you be able to do as a HAS member? Well, if maybe publicly support the vaccine, being able to help register people and go online to get the information to be able to do that. Maybe consider supporting a variety of different nonprofits that serve our impacted youth. It may be through volunteering, it may be through giving, it may be through connecting and learning more about their program, it may be sharing with others. But everything from Boys and Girls Club to Culture Works, Escape Ministries, Kids Hope, LAUP, Midtown Counseling. There's just a few of the many different entities that you could support. Out on the Lakeshore, Ready for School, The Bridge. There's a list and list of nonprofits that can support youth in our schools. Because everything has changed. And these are just pictures from our graduation ceremony last year. And we're going to have to do outdoor graduation ceremonies again this year based upon what we're hearing and see. But we want to make sure that we're providing the best possible experience for our young people across our community, so that regardless of where you live, what race you're from, what your economic level might be, you're going to be in a community that supports you, that loves you, that cares for you. And we're going to continue to provide the absolute best possible education for our kids. You have been a very quiet audience. I know because you're all because I did that, but I'm sure we have lots of questions or some questions that we might want to be able to ask.
Dr. Davis,
yes.
You know, I did not see that Lee was not receiving questions. So there are a couple in the chat, but apparently I'm only seeing them as the host and not her as the co-host. So I'm going to go ahead and shoot you a couple, okay?
That's okay. You bet. Let's go.
Anna early on commented that the cooperation is wonderful to hear about, and I'm sure that that was a big topic during your talk. Bob Kenny asked, going forward, how can interested HAP members volunteer to be of service in Holland Public Schools? Is there anything specific you would recommend if any of us are interested? Thank you so much for this presentation. It seemed like that was just addressed. Do you want to expound on that a bit?
Sure, there are a number of ways that individuals can become engaged with the schools. Unfortunately, right now, we're just beginning to open up to volunteers to be able to come in. So some examples of that right now might be, if I'm not physically able to go in, and if I have the resources available to me, how might I consider making a donation to entities like the Boys and Girls Club that'll be doing summer programming, the Outdoor Discovery Center, DeGraff Nature Center, some of those counseling agencies that I suggested, like Mosaic Counseling, Midtown Counseling, Arbor Circle, Bethany Christian Services, all those entities that provide mental health support. Ready for School, that will be working with our preschool kids across the community to ensure their school readiness, things like that. If you really want to engage in a mentoring side component and get ready for that, perhaps you attend a church who has a very active Kids Hope USA mentoring program. We have several churches who are engaged with that work. Young Lives is another program. Youth for Christ is another program where mentors and individuals come into play. We may have opportunities this summer for individuals, if we can get back to regular school, maybe by this summer we'll be able to do that for in-person learning. We always want to be able to have individuals that can share their careers, what they did. It's always great for students to understand, oh, I'd like to be a X, and to have somebody who can share what their career pathway was to get to that position, or college experiences. That would be the Holland Promise would be another piece to take a look at if you could make a financial contribution, or even estate planning into the future, being able to support our young people in that capacity. Love on a teacher. If you would just like to write thank you notes and you say, I could do that, I would just like, or even email teachers and just say, I'd like to thank you for what you do. I could get you a list of teachers and emails or addresses to write thank you cards or thank you emails. Something as simple as that could make a big difference too.
Okay, I'm gonna start shooting some of these questions to Lee so that she can be involved, but until she sees them, will Holland Public School offer a summer learning experience for students that have fallen behind? You also may have addressed that.
Yeah, we're actually working with the Outdoor Discovery Center to provide a non-school based experience as much as we can. We want to get kids outside. We want to get them out to the Outdoor Discovery Center so that they're engaged in hands-on, minds-on learning and being able to learn those standards and different things they need to do without having to be in the classroom. We want people to be outside as much as possible. We may not do the 8-week summer school program that's required by the state to get additional funding. We have funding reserved from last year to be able to do our own program, but we're definitely going to be providing some kind of options for kids.
There's another question. Do you believe that addressing the school to prison pipeline has impacted student behavior yet? And I'm not sure exactly what that means.
Yeah, the school to prison pipeline has a lot of components in it. And a lot of it has to deal with the disproportionality of the ways in which students are disciplined in school. And there's been, and we've had this in Holland, we're narrowing that gap pretty significantly with our work around positive behavior intervention supports and restorative justice. But unfortunately, students of color in classrooms are disproportionately suspended or expelled from schools. Which then if you are, especially Black males, then you're missing instruction and engagement and learning. And so the more that you miss from that, then the more likely you're to potentially be a dropout and things of that nature. But we have to recognize that to address the school to prison pipeline, we also have to be able to address federal law. We also have to be able to address state law. And so we have institutionalized racial practices that have to be addressed as well. And it's sometimes difficult for an individual entity as part of a larger ecosystem to do that singularly on their own, but we're definitely trying to work in that domain. And we have a director of equity and inclusion now in Holland that is assisting us in that work. And he may be an individual that you may want to have a future HASP class with to talk about understanding our own privilege, understanding our own biases, and being able to better understand what historically has happened over the last 400 years, what really happened. Some good books to read, Lies That My Teacher Told Me, or Stamped, some real historical accounts. What really happened during the Emancipation Proclamation, What was really behind the thinking of Abraham Lincoln? What really happened with Brown versus the Board of Education of Topeka? What really happened with Plessy versus Ferguson? We're only a few decades removed from just real incredible segregation in our country. When we look at what happened January 6th, when we look at what happened in Grand Rapids last night, the people who were arrested during what was otherwise a peaceful demonstration around the trial starting with George Floyd, what happened last summer with respect to Black Lives Matter March. We have a lot to learn as a country in that respect. And the prison to school pipeline is but one sector of that in terms of a larger community scale.
Oh, that's really helpful. Also from Marie Hamilton, Brian, thank you for your many years of service to our Holland Public School families, and your impact has been valuable and far-reaching. So best wishes in your retirement. This has been, quite the year for you.
It has been, but I will share with you while I'm going to be. It's like when I left the classroom 25 plus years ago. It wasn't because I didn't love teaching. It was because I wanted to be able to have a greater systemic impact. And when I left the building principalship, it was the same kind of thing. So while I am stepping away from a school district, I'm going to be stepping into a new role that will allow me to have greater state impact, and hoping to be able to continue the work that we've done here and to be able to expound upon the work around equity and inclusion and being able to address the unique learning needs of each of our kids in a state level way. So looking forward to that. So my work is far from being done.
Well, and I think, again, the models that you've developed and the approach that you've had, being able to share that with other communities, because as you say, it's a prototype for what happens next, whether it's new strains of the virus or, the next time, something comes along that of this magnitude, we can't even imagine. But there's certainly a lot that's been learned that LA schools and New York schools and many schools would benefit from. Let's see, I have from Norma. And let me see. Regarding the current Michigan funding of schools tied to eliminating the HHS control over school restrictions. And a point raised is about their requirement to give decisions about school openings to local health departments. The local health departments are county oriented, so that's important. School districts do not always follow county guidelines, and she sees a problem with that. What is your thought about that? Sort of the difference between health departments and then school districts.
Yeah, that's a great point to make. I would always advocate to the highest degree possible we have the greatest amount of local control at the local level, right? Because what happens in the city of Holland can be very different than what's happening in Spring Lake, can be very different than what's happening in Hudsonville. The challenge is building consistency. We're here in the city of Holland, but we straddle two counties. So we had Ottawa County and we had Allegan County, and the two different health departments weren't always on the same page or communicating in the same way. And so there's a consistency model even among health departments. So, but I also would say that I am not an epidemiologist. I am not well versed in virus strains and pandemic things. And so given the responsibility to me to make those health related decisions, I don't necessarily want either, but I want to be able to have the best information given to me. And I really want to be able to work together as a team. To be able to work with Tom Martin when he was still with us at West Ottawa, Cal DeKuyper in Zeeland, Dave Thiebel in Hamilton, Shannon Brunick at Black River, Dr. Forseth at Holland Christian, to be able to work together, to learn the best practices together, to be able to bring our community together. That's what's really gotten us, I think, through this pandemic. It wasn't the isolation and working in silos. It was everyone coming together and working together and sharing of information. With the current bill that's headed to the governor, it does not strip away the local health department's ability to close a school district. And keep in mind, they've been doing that whenever attendance rises above 25% related to the flu. So this isn't the first time that we've been impacted by things like this, or back in the days when chickenpox and measles were huge issues. But this is the first time we've faced a pandemic like this. So it'll be interesting to see how this all shakes out.
Another question in terms of the retirement, so there have been waves of teachers that retired because clearly it's been tough. And you say there aren't the teachers in the pipeline. What kinds of strategies have you thought about for getting the teaching support back into the school system on the outside or?
Well, it starts from the top, and I certainly hope that the U.S. Department of Education can take a different stance with respect to public education in our country and in our state, and to be able to really value the work of educators. We have to lift the profession. We have to lift these men and women who are in the classroom day in and day out doing this job. Beyond that, we have to be able to grow our own. We have to begin to identify children in the classroom, middle school, high school, who are interested in the teacher profession, to be able to do that. We want to be able to lift individuals in our schools that look like our students who attend our schools. So we're able to, we can recruit individuals from different communities to more reflect our student bodies and demographics, but we're not always able to retain them. So we have to be a community that really honors and respects inclusion and diversity across the board. But if we can develop students from our own teacher ranks, we could hopefully be able to retain them in our community. We have to look at our instructional assistants, our bus drivers, our food service workers, who may have never thought about being teachers, to be able to recognize and say, you know what? The way I see you interacting with kids in the lunch line, you'd make a phenomenal teacher. So how do we provide teacher grants for our bus drivers, our instructional assistants, our school secretaries that just could, with some additional training and support, become great teachers? And we have to make the profession a livable wage. If you are a brand new teacher with a family of 4 in Holland, you qualify for reduced lunch.
Wow.
That shouldn't be the case. We have to make housing affordable in the city of Holland. Many of my new teachers don't live in the city of Holland because they're unable to find affordable housing. So a lot of my new teachers live in Grand Rapids or Benton Harbor or South Haven or Muskegon. They're driving in. And you know what happens? As soon as they can find a job back in their local community, they're going to stay in their local community. So we have to be able to address the affordable housing issue, not just for who we oftentimes think, but for a lot of different professions, teachers being one of them.
Good. We're coming to the end of our time today, and it's been a fabulous presentation. I'm sure that none of us really knew and appreciated what was going on, and have had such great illumination about the issues and the successes, and it's applaud everyone's efforts because it's been inspirational.
If you know, I'll just leave with this. If you know a teacher in any of our school districts, thank them.
Yeah. Over and over.
Thank you.
Thank you so much, Dr. Davis. We do appreciate your contribution to HASP. And although I wasn't actively involved in the class, your content and your presentation that I did here was very well done and well received. We really appreciate it.
It's been my pleasure. And I wish all of you continued health and safety. And now your homework assignment.